Thank you for joining us. Before we get started, I'd like to acknowledge the fact that yesterday we had a few comments about touching the podium between our speakers, and so today I made a special effort to clean the podium after the fact. Thank you for your comments about that. You're absolutely right. We need to be vigilant in making sure that we're not unnecessarily spreading COVID, and that's part of that. So thank you for noticing. To announce our test numbers, we have 222 tests and 5 positives. Before we go any further, I'd like to acknowledge the fact that that 222 number is not representative of the full sample of tests that are coming from Lane County to our various labs. That is largely due to a couple of different factors. One being the fact that one of our largest labs that processes between 30 and 40 samples a day is doing what we call batch reporting. So they are saving up their test results on the negative side for 2, 3, 4 days and then reporting those negative tests back to us. We are, however, getting the positives in real time. So our positive testing is not lagging at all, but the negative numbers that you're seeing, those overall test numbers, are coming in slower. Another reason is that one of our other lab partners who does process a reasonable amount of labs is not currently reporting out the negative numbers. So we are working with them to make those numbers available so that we can have a better picture. As we start to see these numbers really climb, into 500, 600, 700, and beyond, then they will become less of an important factor in understanding the level of testing and really just assuming that testing is happening. But for right now, the number that we have as of yesterday evening was 222 with 5 positives. We announced yesterday evening that we did have our 5th case. That was a woman from the Eugene-Springfield area in her 40s. At this time, she is medically stable and at her own private residence. She's in communication with Lane County Public Health Communicable Disease Investigation Team and abiding by all public health recommendations, including staying home. So that's good news. We have been able to get a better idea of her system onset and how the disease progressed in this individual case. So beginning on March 7th, she had that initial exposure as we had talked about previously in our press release. We believe that that happened from domestic travel within the state of Oregon. Then it progressed on the 9th to a dry cough and a sore throat. By 3/17, she had developed a fever and then went into a care provider and got tested on the 21st. And then, of course, we reported out those test results yesterday evening. No additional public contacts have been identified, so that's good news. If that information does become available, which we don't anticipate at this time, we will make that known. We have received a few questions in, why don't you report down to the city level or the neighborhood level? And so obviously a very valid question, and I want to just hopefully help people understand why we don't do that. You hear a lot about patient privacy and how important that is. For us at Public Health, it's not only the law, it's also critical for us to build trust in our community so that people can feel free to share information with us, which will help us in responding better. If we felt as though an individual was not abiding by public health practices or we couldn't count on them to help prevent the spread of COVID, then that would be the situation where we would weigh whether or not to share more information. So far, everybody that has tested positive has been very, very pro-social and willing to help and do what is necessary to help prevent that spread. So hopefully that gives you a little bit of insight as to why we don't make that information readily available unless really we deem that necessary. I'd like to report out on our PPE donations. We said yesterday that there was a quote-unquote big stack. That stack was counted yesterday, and I'm happy to report that we have nearly 101,000 pieces of PPE at our warehouse on North Delta Highway. That sounds like a huge number, and it is. However, it's good to keep in mind that some of that number comes from nitrate gloves. They come in packs of 50 to 100. So that number is slightly elevated. It's not like we have 101,000 masks per se, but a great start. We need that PPE to keep rolling in. So if you are an industry that has been shut down or a business that has been shut down, you have spare PPE, you can make those donations to the Lane County Public Works warehouse at 3050 North Delta Highway between the hours of 2 and 4 p.m. Monday through Friday. Also, I just would like to call out a couple local distilleries. Thinking Tree Distillery here in Eugene and Swallowtail Spirits in Springfield have been fantastic partners at manufacturing what you see here, which is hand sanitizer. So Lane County Public Health has bought bottles, and then we've worked with those partners at those distilleries to to package this. You can see their logos on there. They've been tremendous community partners. To date, we've purchased almost 50 gallons of hand sanitizer that will go out to first responders and other medical professionals to try to backfill that need for hand sanitizer. And so that is just a really great example of how that's rolling out. I know they've worked with other entities as well to provide hand sanitizer. So that's some of the great work that's happening at a community level. Last night I spoke with a few different neighborhood associations who are really looking at their neighbors and making sure that people are checked in on, that they're okay, that they have what they need. And that community response is more than encouraging as we see what is needed to keep our community going through this time. The State Public Health Lab, just on an update on testing, has made verification panels available for several labs, OHSU, Kaiser, and Providence Lab. That's great news because by providing those verification panels, which is essentially like a test that the state lab is able to administer for those labs to get them that FDA approval to start operating as a lab, as we see those come online and that service being administered through our State Public Health Lab, we'll see less pressure on any one individual lab, which means more testing and a greater understanding of how COVID is spreading through our communities. So that's definitely good news. I also have heard the range on test results is lasting anywhere from 24 hours on the best case scenario up to 6 days. So it really depends on which lab your provider orders their labs through. And so just keep that in mind as you're looking to your test results and when they're coming in. I know that we've heard some people frustrated with having to wait multiple days at times. Lastly, I'd like to give an update on our hospital situation. That's definitely of concern. Fortunately, starting in early February, the preparations began between public health and our local hospital groups, really looking at what COVID could mean for them in terms of a surge of people coming into the hospital, ventilators, triage systems. And right now, as of this morning, our hospitals are in good shape. They are stable at the moment. We've had fantastic communications. Those proactive options around triage and making mobile units outside the hospital has been ongoing, and they're going through troubleshooting to make sure that that's all ready to go when needed. They're doing temperature screenings at all their entrances, also restricting visitors and canceling non-essential services and procedures, which will help alleviate the overall burden on the hospital system. And then, making sure that they are stocked with PPE has been a priority of public health, and they've been looking at rationing their current supplies to make sure that they are stable. And as of today, they are stable. So locally, we are doing well. However, it is important to acknowledge once again that our local business community is being impacted in a tremendous way. Any way that our people here in Lane County can continue to patronize the businesses that are still available. Restaurants that are doing takeout service or delivery service, making sure that you utilize those services to try to help our businesses stay afloat. Thank you, and we'll see you tomorrow. So at this time, we will go ahead and take any media questions that members of our media partners have.
So Kelsey from KMTR is wondering, is there a timeline for the respite shelters for the unhoused population?
So Kelsey's from KMTR's question is there a timeline for the respite shelters for our unhoused population? And the answer for that is yes. We had a soft rollout yesterday at the Eugene location. From what I understand, there were a number of people who spent the night last night, and that number will increase in the next couple days. And so, this is not what you would see on a typical shelter situation where we have a ribbon cutting or a grand opening. That really what we're trying to to do is connect those individuals with services and make sure that they have what they need. So that's happening through outreach teams across the area, and then those shelters are on board. The Springfield location is looking to be up and running shortly as well.
Where is Lane County at with expanded testing capabilities? Also from Kelsey.
Another question from Kelsey, where is Lane County at with expanded testing capability? So I just talked to Dr. Ludke this morning about this very question, and what we're looking for right now is that rapid testing piece, and that looks like it could be rolled out within the next couple of weeks. So that's sort of a vague timeline, I understand, but that's the best we can do right now. We also have some research labs that are looking to come online in the near future. Part of the slow process of getting those research labs up and running for a local testing option was contingent on making sure that they had the proper equipment. It takes a little bit of time to requisition that equipment or get that equipment in and available for usage. And so that's all happening right now. As far as an exact timeline, where this is involving other agencies, and so I wouldn't want to go out with putting them on the line for a timeline, but I do know that the work is happening, and we're optimistic that it's going to become a local option. In tandem with that, the labs that we send samples to are also expanding their capacity. So Quest Lab has almost doubled their capacity. Our state public health lab has almost doubled their capacity from around 80 tests being taken a day up to 160 per day. Those numbers sound small, but it's important to remember that doubling really does have a huge impact on our ability to get those numbers. And I will circle back just to the fact that that 222 number, so 222 Lane County residents who have been tested, is far higher. What the exact number is, I can't report on just yet, but it is significantly higher, and I hope to have that information for you soon.
Question from Brian over at KZI. What is the status of the 4J bus driver diagnosed with coronavirus?
So the question from Brian at KZI, what is the status of the 4J employee who was diagnosed with COVID-19? And so my understanding is that individual is medically stable, remains at home, and still has a ways to go on recovery, but is doing well, which is fantastic news. We want everyone to recover from this who falls ill. And that's all we have. Thank you.